Everybody, here are the toddler slides that we didn't get a chance to finish today because we did do a lot in the beginning. I didn't realize that it was going to take us 45 minutes to go over all the stuff. So here is the toddlers slash preschool. All right. So again, this is the formative years. Infant and toddler, there's a lot that goes on. These are the specific milestones that kind of stand out when we think about toddlers. From a physical standpoint, um, their weight gain slows, so they gain around 2 to 3 kilos yearly. Their height is at 2 years, about 50% of what they will be as an adult. At 12 months, their height increases about 3 inches a year, and then their head circumference and their chest circumference usually equal by a year old. Birth triples. Birth weight triples at this time, and then 12 to 18 months, the anterior fontanelle closes during the toddler time. And then sleep is a little bit less. So usually by two, they're having 11 to 12. If you recall, for infants, it was like 20 hours of sleep, which includes the naps. Okay. So so screening for developmental issues still continue during this stage. We're seeing a lot of them trying to gain more of a sense of independence by dressing themselves, doing things more with their hands, feeding themselves, obviously. Potty training, we'll talk more about potty training, but usually we like for it to be completed by 3 years old. They will definitely use language, meaning vocal speech, using words, and they will use gestures to communicate. So the gross motor skills here um, are kind of broken up. This is from the textbook. You do kind of have to know this, but you just need to understand it for the progression of how it goes. So remember when I talked about in the assessment lecture about going from simple to complex. So they're going to still be mastering the gait and the walking. They're still off balance at age 2, and in the next slide, you'll see how we can literally look at a child and tell you where they are on their milestones by just looking at their gross motor skills. Um, Eventually, they can walk, certain big steps. They need assistance. And then by 18 months, they should be able to kick the ball forward, um, walk downstairs one at a time. So that's a two-step type approach. Um, and then they will then get more complex by jumping and running and skipping and all these things that they can do from a gross motor standpoint, all the way up to running and then doing skating and swimming and so forth by preschool. Let me see here. So here's the picture I was talking about. So as you can see this one here, she looks like she's probably like around 18 months, not quite two. Same thing for the boy. They have that wide gait. So their balance is still very much off. And so they can easily fall, but they are walking at this point, and they need that wide base for a firmer stance. But then as they get older, look at the gate. If you see where my cursor is, it's more narrow, and so they have more precision and ability and better balance, and so they're able to do more complex skills and obviously walk a little bit more with an up straight gait. All right, so now let's jump to fine motor development. So when we're assessing this age fine motor, we're looking at what they're drawing. Right. So we're giving them crayons, markers, pens, whatever, and asking them to draw us a picture. And we see what the picture looks like. So they should obviously, we left off where they should have that neat, crude, or neat, fine, crude pincher, grass, whatever you want to call it. Um, and now we're seeing what they're doing with it. So early toddlerhood, they're pretty much making lots of squiggle lines, but it's not just looking at the picture, but looking at how they're holding the device that they're using to make the picture. And then as they get older, it gets a little bit more neater here, right? A little, we can pretty much make out what they're writing or drawing. And then around 4 or 5, they put in a little bit more detail. All right, so this also tells us a little bit about their cognitive function as well as their fine motor. And so they are getting a little bit better with making formation of people, pictures, animals, and so forth. Make sure you put a star on this slide. All right. So also this kind of talks about the other things as I just remarked, like we're looking at how they're holding things. Also, you want to look at how they're holding utensils, how they can pick up certain things and easily, stack the blocks without it tumbling down and so forth. So just take a look at this and like I said, go through and just see how the progression is. I would not recommend you trying to memorize this unless you really want to, but you should understand the progression of it so that if you're looking at something or reading something, you'd be able to say, oh, ideally, this is a 12 to 18 month, or this is achieved by 2, and then this is achieved by 4. So break it down like that. So language development, this is the language area, so 12 to 18 months. Again, we left off with them saying certain words, 3 to 5 words. But then by 2, we can see, follows directions, points to specific body parts. They will start making little bit more sense. Me want milk, and give me that. Very demanding times. Not all children are demanding, but pretty much understand that we can comprehend them a little bit better as they get to 2, and then definitely by 3, their language becomes a little bit more developed. Again, this is a video showing you the different things from the CDC. If you want to watch it, it's up to you. It is optional if you want to. All right, so back to this slide with autism. So autism is screened pretty early. It's before the age of 2, and there are certain things that have to be in place. There's 2 behavioral domains for diagnosis. We have social interaction and social communication, and seeing some type of repetitive behavior or interest. So looking at AJ with Nina in the picture, that's my daughter, and that's AJ, one of my best friend's son who was born with autism. I think that's my phone. So he was very fixated on my phone at that point. And he just would not put it down. I think he played with it for hours. So this is not like a normal, like a child interested in like a video game. No, he was really interested in my phone. I think that was my old case. So anyway, we see repetitive behavior. It could be sounds, it could be movements, something that they do that could be like to calm themselves. She actually started an organization recently. I can't remember, Everyday Autism, I think. Um, and she's up north. She's in Delaware, Philadelphia area. So autism can range from mild to severe. I would say he's close to severe. It was a really tough time because he had a lot of other sensory issues. Because they have great intellect, they are very smart, but they have a lot of sensory disorders. This most common milestone is responding to name and also lack of eye movement. And I saw these signs. It's the first time I met him when he was a baby. He had a very hard time with me holding him, and he would not look at me in my face. And that is very uncommon for a infant, probably that I think he was like 6 months old at that time. So speech delay. He really does not talk. He does say some words. In fact, I know, here we go with with Nina again. So when he met my daughter, again, she was the only person who could get close to him, as you can see. First, that was her first time meeting him. And when we were leaving, he had a fit. And then when they came to visit us in Atlanta, we were all just talking like normal. AJ was there. He saw Nina, and he literally walked up. He said hi, and Deneen, who is his mother, literally almost dropped what she was holding because he never greets or talks to anybody. And I just laughed. I was just like, he has a crush, right? so, um, so anyhow, so AJ really, sorry, let's get off of AJ. So let's just say this is something that's very, very common, that they really don't make that communication, that bond, that connection, and that their way of communicating is different than when we communicate because they do communicate. I used to be a caregiver when I was in nursing school, and I would watch over some of the children who had autism, and some of them used a communication board to communicate with me, and that was perfectly fine. They would tell me what they want or how they felt, if they had to go to the bathroom, and so forth. So there's different ways, and I know that he has some communication devices as well. All right. So they also have increased reactivity, anxiety to touch, 100% with AJ, except for my daughter. There are some comorbidities. So this is where I mean that we were kind of worried about him at some point, because texturized foods and texturized things really unnerved him. So he would not eat. And she made the decision that she was not going to put in a G tube, because they were saying he might need supplemental feedings because he wasn't thriving and growing at that time. And this is actually during the you see him here, he was definitely not eating at that time really well. So she would give him a lot of Pediasure. Anything she can get down would be great. So she worked with him, his therapist worked with him, and now he's eating like a horse now. He's super, super tall. But that comorbidity could be a problem, and he was failure to thrive. So a lot of these children who have autism, they develop failure to thrive, nutritional deficits, as well as some mental issues as well. So nursing education, you got to understand that caregivers are very important here. Take your cues from them. I take my cues from Deneen because I don't see him on a regular basis, and so he's not comfortable around me at all. I stay neutral, and you understand, what communications that work for that child, and just plan appropriate care. The MChat, and now there's an MChat R. This is a screening tool that a lot of providers use and families use to screen their child. It's a two-part screening. There's 20 question surveys aimed to determine communication and behavioral delays. There is a link to an MChat result if you want to see what it looks like. A score of 3 to 20 requires adequate follow-up, and providers use a flow chart to determine if a child has autism. By the way, I don't know if you guys realize that the school that's right next to Burnell University in Norcross is they open up. This is now an autism a center for autism. So really, I was really curious to see what they actually do there, because they recently opened up within, I think, within the last year maybe. So anyhow, so that is a facility that actually serves people who are living with autism, and of course Children's Healthcare of Atlanta has one as well. All right, so hygiene and personal care for toddlers. Bathing is usually needed daily. They get very stinky because they play really hard. We never leave them in a tub alone or anywhere around freestanding water. This is also the time where they develop their genitalia, so you might see a lot of fondling and so forth. Very, very normal. Again, remember they're very sensory. They're pleasure, so they seek out things that make them feel very comfortable. And if they happen to discover that, it's very common to see children who are doing that. It's just redirecting them, and not putting a whole bunch of shame on them, because that's not a good thing. Because as when we get to the psychosocial of Erickson and Piaget and cognitive, that can actually cause a lot of shame on these children. All right, fluoride treatments are continue to be recommended. Use regular toothpaste or low fluoride if the child can rinse and spit. Dentist visits are every 6 months, just as I mentioned before. That has not changed. They should at least take one nap a day, okay? But it will wean off, and it does depend on the child. All right. So toilet training. So believe it or not, they usually get anal sphincter control before they get bladder sphincter control. So usually they achieve toilet training um, again by 3, but they can get the stool versus the bladder. All right. Girls usually achieve toilet training before boys. But remember, both parties need to have the ability to control their sphincters, and understand the sensation of when they need to go, and to communicate that. All right. Daytime bladder control before nighttime. They completely need to be dry at night for a while before we can really say that they are toilet trained. All right. So let's see. So this is a chart. I just like to just give you a suggestion. This isn't something on the test, but the reward system that I mentioned before in class, besides food, remember? So reward system. So this is a sticker chart. So sticker charts have known to be very helpful for toddler stage when they're doing their toilet training. And I used to use this for my daughter and it worked phenomenal. So, she got one sticker for when she pee-peed in a potty, and then she got 2 stickers for if she did number 2. And she could stick it anywhere. It was her stickers and her chart, and that reward system really helped her, achieve toilet training very fast. So there's different reward systems that people can use, whatever works for the child as long as it's consistent and it's not food. All right, so speaking of food, nutrition. So by age 1, again, we have that, table food. Remember, 6 months is solid food, but table food for age 1. And then, so by obviously toddler, they should be definitely eating what the family's eating. They can have whole milk by age 1 year, if we talked about it before, but it really should be limited to 16 ounces per day. We don't really want to give them milk and cause another whole host of allergic issues. Um, Okay, let's see here. 3, they should be having 3 meals a day. Always still recommended to use the My Chart. You'll hear that again in school age. It's basically the land, there's a guide to tell parents what should be stacked on a plate. Um, may need a supplement if they are a picky eater, so they won't eat certain things, just to make sure they get the adequate nutritions that are necessary. Finger foods are appropriate as long as they're not chokeable and they are able to chew their food completely. Remember, parents are the best role models. Parents need to demonstrate to children what they would like for their children to do. So they can't go over there having fast food and say, I need you to eat this because the doctor said so. Yeah, that doesn't work, right? You all need to eat what the same thing, and be a good role model for the child. All right. Let's see here. Oh, big one. So try not to let the child graze. So this stage, they will kind of like graze and eat little here and there. It is very important, even though I know that parents think like, oh, I want them to be healthy. I want them to have the good nutrition. But when they're done, they're done. It's not like you're gonna eat here and then go run and play with and then go in your room again. And I've seen parents do that, and that's not a good way to teach them how to one getting good nutrition but also eating habits. It's a very poor eating habit, so just wanted to point that out as well. All right, so this slide really just say the typical fears of this age group, and this, remember, this is toddler and preschool. Very common. um the duty to perform, I just want to point out because you're probably like bath and toilet. So bathing for some kids is not they don't like it. They just don't like it. I personally don't understand it, but they don't they don't like it. Toileting also is very stressful because a lot of times, they want them to achieve toileting, but they just can't seem to get it. And this happens a lot with the boys, because they have to not only go, they have to aim correctly. And everybody's, they're looking at them. And so, believe it or not, we do have some issues with toileting just simply because of stress, and they become fearful when it's time to go to the bathroom. And they end up holding and causing bladder and bowel issues, which we'll talk on in another lesson. Um, but costume characters, falling, the dart, stranger danger, these are very common things that we see at this age. All right, so for their psychosocial development, first let's talk about play. So, play enhances their cognitive develop, problem solving, creativity, and coordination. I mentioned that in the first day that it has a lot of benefits. It also tells us a lot about a child's development, how they play and how they interact. Are they playing by the rules? Are they being a good team player? Are they getting emotional, angry, violent, right? Are they able to cooperate? These are psychosocial signs that really can point to their not some things that could be going on mentally or socially from a developmental standpoint. Okay. So it's critical to look at that and to observe that from time to time. We also see some gender identity issues pop up at this time because they may end up showing certain behavioral tendencies, and that is something that needs to be dealt with and talked about, especially on the side of the parents, so that they handle this in a in a positive way. Association or labeling begins. The real young ones, you'll see parents like spelling things out, but as you get older, that's a wrap. They know exactly what you're talking about. They can spell or sound it out. Basically, what I'm trying to say from a cognitive standpoint, these kids get very bright. They begin to develop the intelligence and the ability to understand what's going on. So for Erickson, um, let me see here. So Erickson's stage, for this stage, toddlers are faced with the mastery of several important tasks. Okay. So it's autonomy versus shame. And so here they're trying to achieve autonomy in being able to get a sense of independence or independence, right? And so that's where you say, let me do it, right? I want to do it. And allowing them to struggle a little bit is okay. And if they do need help, helping them a little bit, but we really want them to achieve that sense of autonomy versus telling them to go sit down, be quiet, or not including them in things that they really want to be included. Yes, it's going to take a little bit more time, and you'll hear me talk about this again in school age, but it really helps to contribute to their self-esteem. Negativism and ritualism. So I kind of talked about this a little bit, but really it's all about them saying no. So negativism um, is when they focus on acts of negative responses or to requests. The words no or me do basically becomes the center of their vocabulary. And that is something that we typically see in the toddler. However, for ritualism, this is the need to maintain sameness, reliability, provide a sense of comfort. So these toddlers are usually very into a structure. So I don't know if you recall when I said that if they're hospitalized, if they have a nap at a certain particular time, or if there's some routine, we should try to do it because this is a big deal to them, right? So they're in this environment, we're doing all these things to them. If there's something that they can or we can do to help make it less stressful and continue with their rituals, then that would be very helpful. All right. So, so Piaget. So for Piaget, this is the 1 to 2 years is the end of the sensory motor, which I already discussed. And then we're going into the pre-operational phase, which is from 2 to 4. All right. So pre-operational thinking basically is saying that they cannot think in terms of operations. All right. They're not able to understand when things are manipulated that they are either the same or the different or whatever the case may be. So this is where you come into eventually going into the theory of conservatism or conservation. All right. So I talk about that more in school age, but because at this age they haven't achieved that, right? And so that test that we do really kind of gives us an idea, are they in pre-operational phase or operational phase? All right, but in the pre-optimizational phase, you'll also see increased use of language as a mental symbolization, egocentrism presented in play and in behavior, an increased sense of time and space, and this is causing this, but not really clear 100% like they do in operational. Let me see here. So, some other things I want to mention. I think I wanted to mention. Oh, yes, I wanted to mention the key characteristics in box 12.1. So there's a whole bunch of things. So there's a whole bunch of things that we usually see: animism, inability to conserve, is what I was just talking about, egocentrism, and there's some other things listed. So make sure you take a look at that as well. So last, we're going to talk about Colbert. So here's where Colbert's level comes in. This is the moral development. So this is the pre-conventional stage 1, and it's simply saying good or bad. All right. Everything from a moral standpoint, if the parents or somebody who is who is an adult says that this is good, this is good. If they say it's bad, it's bad. Okay. And then they'll either get rewarded or they get punished. And so that's how they look at it, very clear, straight, and to the point at this stage. So this is the pre-moral stage. All right. And then we have preschooler 3 to 5 development. We have Erickson. This is the sense of initiative versus guilt. Kind of the same situation, but here they have what we call a super ego. All right. And then with Piaget, I know you guys had this before, still in pre-oppositional phase. And they have an increased curiosity about facts and classifying objects and be able to identify shapes. Kohlberg is unchanged, and then there's some other things that you'll see, which I talked about before. All right, play stages. So this is really interesting because you can actually see the progression of play. Remember, I said we all like to watch and see how they're playing with others, looking at their behavior, looking at their social abilities, and so forth. So play kind of progresses through these stages, as you can see by the age and years. And so at first, remember I said infants is solitary play with themselves or with their parents. But then we have the spectator play where a child will observe other children playing and they kind of just stand out there and just kind of take a look around and, just to get the lay of the land. I don't know yet. I mean, adults, we do that too, but you know what I'm talking about. So then parallel plays is that they'll be next to somebody and they might be doing the same thing, but there's no interaction between them. And then associated play is they may be having some association with each other, but it's not structured. Whereas true preschoolers in school age, in the beginning of school age, they are um, they are definitely organizing play, putting down bases, making rules, stating exactly what how it's supposed to go, and then engaging with children in a cooperative way. So here's some pictures of here's a spectator, right? Not really, just kind of looking around, not quite so sure. This one's off to the table by themselves. And then this is the example of parallel, where they're next to each other doing the same thing, but there's no engagement. And then this is an example of associate play. I want to also mention off to the left where you see biting. So biting is a common thing that we see at this stage. It's their way of uh, I can't say aggressively, but basically communicating what's theirs in their territory. Not all children bite. Um, Unfortunately, it's something that they usually observe, and so they think it's okay to bite to get what they want because it seems to work probably with some children. But then they usually slowly realize that that is something that's not acceptable, depending on the parent, right? So I had that issue as well. It quickly ended with my child. I think she was bit, and then she started trying to bite, and she got in trouble. And then the thing about when you're disciplining something like this, it is a good idea to catch them in the act because then they're looking at you like, what's happening? Remember, we talked about discipline. It really should be close to the incident that you are disciplining them about. So me disciplining her 5 hours after the event, I could talk to her about it, but I'm not really sure cognitively if she understood. But girlfriend tried to bite me. Perfect moment. So she tried to bite me one time when I told her no to something and she went in for my hand and I saw her eyes like you lost your mind. So so I screamed at her to the point that she actually like jumped and that was enough. She never tried to bite again. And I was like, you do not bite. And mommy doing that is a big deal. So anyhow, again, that is something that kids usually end up stopping. I would love to talk to anybody about any stories about Bonnie, but that's my story. And she never bit another child again. It is a big deal because if they break the skin, then parents can demand tests and all these different things depending on the type of parent it is. And it just can get ugly, especially if a kid is doing it repeatedly, because then they end up not really being able to socialize with other children because everybody thinks that let's say it's Johnny's gonna bite me if I play with him. So all right, safety with our toddlers and preschoolers. You want to child-proof the home. Obviously, look at poor child. I'm thinking electrocution, car seats. So we're going to talk about car seat in the next slide. And every car after 2002 should have a latch system in the car, which is a safety latch system to make it more secure. What are safety still same sunscreen? Really, they really, I mean, even before then, but they definitely need to be wearing sunscreen because these children love to play outside. Poisoning, because they are moving and shaking, so poisoning caps, secure things that you think that they wouldn't get into, they can get into. Screening childcare persons is very important because they're going to usually be left with somebody, and then we're going to talk about abuse, and they can actually be abused. Um, let me see here. Oh, yes. So do not put anything in a container that looks like candy or looks like something that they would enjoy. So I have a story. I'm not going to share it on this, but they can misinterpret what that is if it's not properly labeled or put up, and it can be a poison hazard. So no, put anything in a container that's not supposed to be. Car seats. So this is the guidelines for Georgia. All right. So up here at the top, we have 1 to 2, then 2 or older. And the thing about the car seats, as they get older and get to a booster seat or to be able to get out of the booster seat, they have to meet the weight and the height requirements. So here are the weight and the height requirements. Make sure you know that. Usually occurs between 7 years old or less. Um, and they still should sit in the back seat, but if they're high enough and the strap goes across, then they can sit in the front. But I always think it's always best to put them in the back. And that's because of the airbags, you guys. And so looking at this picture here, this has to go directly across their chest. All right, so that's that. And then also the airbag is going to hit them straight in their face. So that's going to cause a head injury. And then another thing about the strap, if the strap is too low, that can actually strangulate them. So it's really important that they are in a booster seat if they haven't met it, or if that strap does not come across the way it's supposed to be. And in the back is just a more of a safer place, so to speak. Um, if they were to get hit because of that airbag comes, boom, it's going to just cause a head injury where it was supposed to hopefully try to protect them. So they need to be higher up. So going back to the content on the slide, so there are certain things when they can be forward facing versus rear facing. We already talked about rear facing for our infants, and then they can go forward facing as they get older. And I think really it's about, the space, because, if they're really tall, you're going to probably have to put them forward facing in the back. Okay. So I like this diagram here. It kind of gives you a ballpark of exactly when they can get to these other places. So just using the belt is like around 8 or 9, depending on the height of the child. It really does depend. All right. All right. So make sure you know that. All right. So we talked about poisoning. We talked about these things already. We talked about this. I'm just trying to see if there's anything that I missed, which I don't think so. So make sure you understand the side effects of lead poisoning. Make sure you know that one of the major things that parents and nurses should have is the poison control number. Let me go back, sorry. The poison control number, it is in my phone. It is in my phone. And yes, I've had to use it. Um, because kids get into anything. And the poison control is the go-to place for when there is a child who has ingested or come in contact with something. ICU doctors use it, nurses use it, and families should have it. They are a lifesaver. And I talk about that a little bit more in adolescence as well. So, our last thing we're going to talk about is child abuse. Hate to end it on this note, but unfortunately, child abuse is not cool. All right. And it's happening more and more. So make sure you watch the video that I was discussing. So there's a difference between neglect and abuse. Okay. So neglect means they're not giving the child what they need in order to thrive. And that doesn't necessarily mean just nutrition, housing, physical things. It also is that you have a special needs child, but you're not taking them to doctor's appointments. You're not giving them medication. You're withholding them from going to school. Those are things that actually can get parents in trouble and children can be taken away from them. Children at this particular stage that we're talking about for toddlers and preschooler are more at risk for abuse. One, because they're starting to look, be developed, even though I have seen, God help me, I have seen infants sexually abused. But the this age, they for some reason are predators on this age because they don't really know how to fight back. Right. So, and a lot of parents are in a situation where they have to have somebody watch their child and their back is up against the wall. And certain people that they choose aren't the best ones. And they talk a lot, right? They ask a lot of questions. This age can be very, very busy age. And if the wrong person is watching them and is not trained to handle that, then that can become very stressful and they take it out on the child. So that's what I mean by certain family structures. They usually are in a stressful situation where they have to have some type of childcare. Females tend to be more victims, mostly due to sexual abuse. And then there are some other types of abuse, like the physical abuse, so abusive head trauma, like shaken baby syndrome, and Munchausen syndrome by proxy. So, Munchausen syndrome by proxy, you do need to put a star there. That is a syndrome where the mother is harming the child. So this is a mental health disorder. So we've had some episodes that have been on the news here in Georgia over the past several years, and we've had this in the hospital. And so this is when a child's coming in with a weird kind of situation going on. One was the mother was suffocating the child when nobody was in the room, and saying the child had a quote unquote episode. The last one I heard, because I'm not there. It was the mother was putting antifreeze in the child's bottles, um and they were just trying to figure out because they couldn't take, tasting the child would drink it, had these weird symptoms, and the child basically finally somebody figured out, they're like, this is antifreeze poisoning. And so they're like, how the heck is this child getting antifreeze? And then everybody started connecting the dots, and then they arrested the mom. Okay, so they found her putting stuff in the bottle. So there are rooms that have cameras that a lot of families don't know about it, but really, sometimes, even if there's a camera there, they will still do it because this is a condition where they just can't help themselves, and they have to harm this child. So there's some mental disorder, something mental going on with this mother, and it's always females. It's not a guy, it's some females. It's like a postpartum depression type of thing. And the last one in Georgia, for example, I don't know if you guys heard in the news, is that the sister was on the phone with the mother, and she said she did not like the kind of conversation that they had. So she immediately called the police and says, "You've got to find my sister. You got to find my sister." And so they went looking for her, but it was too late. So they found her walking along the shore of some beach, and they found the children were just lined up. She drowned them all. So this is a woman calling out for help. All right. And then sexual abuse. So Munchausen syndrome by proxy, make sure you know that. The thing, if you come across a child abuse situation, we have to understand that first thing and foremost, we're going to protect the child. Okay. The rights of the mother and the father are still intact, but because the child is at risk and has suspicion of abuse and we don't necessarily know who it is, they usually are in ICU admission because we watch them very carefully. But we would they would be like an open door thing. So nobody can close the door, child can't go anywhere without us being with them, stuff like that, right? Support the family though, right? So until we know exactly what's going on, we are going to support them emotionally. We are going to obviously get DFACs involved immediately. They will have to be in the ICU and they have to be near where we can have eyes on them all the time. Try to remain unbiased, even though we do have our theories, but always try to remain unbiased. Now, some of the things that make us believe that a child is being abused. So I'm going to talk about the physical ones first. So they have head injuries, unexplained head injuries that just don't match up with the story. They fell off the sofa, but the hematoma or the bleed does not match up to the actual blunt of the fall. That it would not created that. If they have multiple fractures in different healing stages, we will do a skeletal x-ray just to see if the child has anything, and we see multiple fractures that have healed or new ones, and with new ones, yeah, that's a sign of abuse. Burns on areas that the child can't reach. We actually did discover one when we were doing an assessment. So that's a big red flag. Bite marks, rope burns, as you can see from the picture there. Let me see here, what else? The way the child is behaving. So here's some other signs. The child is really withdrawn. Sudden change in behavior is reported at school. A child not wanting to sit down because they get beat so much on their behind. Um, Lack of care, lack of food for lunch, lack of clothing, or the child really getting upset when it's time to go home at the end of the day. All right. So those are signs of abuse and also neglect. Let me see here. So this last slide is some of the typical things we see. So this is malnutrition. So this is neglect, right? This is a belt. So anything that has clear defined borders. Um, this is the child getting hit. This is a hand right here. So they hit them on their with their hand. This is this is a cigarette burn. This is what we found when we were doing an assessment. It was on the back of the child's neck when the student nurse pulled me over, and I just talked to the little boy and I said, "Hey, so tell me, where did you get that?" And he just looked down to the floor at that point, and I was like, "Great." So I had to get DFACs involved. It was a mess. It was just a mess. So here is a fracture, as you can see here, but here, with the yellow arrows are pointing, that's a healed fracture. So there's this child, this looked like an infant. Definitely, arm has been broken a couple times. And this one is head trauma. So shaken baby syndrome, maybe. So this, let me get oh my gosh, this thing is so sensitive. So this is a bleed. So this is pushed over brain matter. And the blood is accumulating right here. So this is a head trauma. I don't know if this is shaken baby or blunt trauma, but basically it's a head injury. Okay. All right. Well, this concludes your toddler slides. If you have any questions, please feel free to email me and let me know. I will see you at the Q&A. If you can't attend again, just go ahead and email me your questions and I can go over them and you can view the recorded session. Have a good one. Bye.